always remember that these people are, our patients are people with their own lives, their own families, their own loved ones. So, small little piece of advice, but an important one. Yeah, hey, I'm Monty Downs. I came to Kauai in 1972 and started Wilcox Hospital back then, and actually started out as a family practitioner my first 5 years, and then switched over to full-time ER physician when that specialty got going. And I worked as an ER doctor until April 15th of this year, and then I retired. In my first 5 years, I was a family practitioner, and we had an ER at Wilcox, which when I say ER, emergency room, it was one room. Now I don't know how many rooms there are, but it was one room with a TV set and a couple chairs and a gurney in the middle of it. And so as a family practitioner, I would see my patients that ended up in the emergency room for one reason or another. So that's why I say that I actually worked in the emergency room for 50 years. Even when I was a GP, I did. Back then, you're on call at night. Now things are different because there's what we call hospitalists. And if you're a family practitioner and your patient goes into the hospital, you're kind of done for a while with that person. The hospitalists manage that patient. Back in the 70s, we did it all. We came into if my patient was in the hospital, I was coming in once or twice a day to see the patient, and plus a very busy office practice. And for young doctors that are actually already in medical school, the advice I have for them is whatever field specialty you choose, remember that your patients are people, and everyone who comes through the ER, I may or may not be able to teach them about a certain technique of inserting this kind of tube or that, or using this kind of medication. But the one thing I tell them is, if someone says, hey, there's a heart attack in bed too, I tell them, always say there's someone with a heart attack in bed too. It's a little thing, but to me it's really big. And that's the one piece of advice I always have for doctors, nurses, ward clerks. It's easy to get to miss that. And to me, that little thing keeps you mentally realizing that these are human beings with their own families. It's not just about us. It's their family.